Good afternoon. I am Tara Register. I'm patient educator with the Stephen and Barbara Slaggy Mayo Clinic Cancer Education Program. I will be moderating this session today. We are so glad you are here with us. The session is on understanding lymphedema, what to know, and to take control, presented by our own Jennifer Brandt, a physical therapist here at Mayo Clinic. And at the end of the feature, we will do a live Q&A session to answer some of those questions. We want people on this webinar to know that the session is being recorded, so individuals who are not able to join us for this live session can watch it later. For those who would like to view this webinar again, the recording takes about 3 to 4 days to be edited and put on the video library tab of our cancer education group on Mayo Clinic Connect. So Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect, get evidence-based information, and get access to information about classes, webinars, our center offers. We encourage you to follow the cancer education blog on Mayo Clinic Connect so you can stay up to date on education opportunities. We will put the link in the Mayo Clinic Connect Cancer Education blog in the chat. So you can also click on the classes and resources tab to find out about more classes and webinars. But I also want to make a quick announcement for the upcoming webinars that we will be having. Our third session of the survivorship webinar series will be presented on September 7th, and that will be tools for wellness, healthy weight, and eating habits. We'll take a few questions at the end of the session. Like I said, if you have any questions related to this webinar topic, please type them in the chat function at the bottom of the screen. So we'll go ahead and turn it over to Jennifer.
Hi, my name is Jenny. I am a physical therapist and I'm here in Rochester. I'm based in Rochester. I do know that throughout the enterprise, Mayo Clinic Health Systems and Florida, Arizona, they all have therapists who specialize in management of lymphedema and also management specifically for people who are living beyond breast cancer. And so today I wanted to talk about lymphedema. It's something that many people have a lot of anxiety about, and I want to talk about who's at risk, what you can do to help prevent progressive lymphedema, and what to watch for. And so I am going to share my slides. And I'm going to have to go back a few, sorry, I have to go back to the start. To previous. Uh-oh, sorry about that. We had it, we really did. Okay. There we go. All right. So we're going to talk about understanding the lymphatic system and lymphedema. So the lymphatic system, what is it? Well, it is a system of small vessels separate from the vessels that carry your blood. In this picture here, you can see the red and blue vessels are the ones that carry blood. Those are blood capillaries. The green are the lymphatic vessels. The picture is a little bit off in terms of its scale because lymphatic vessels are actually much smaller than than blood capillaries. The vessels that carry our blood is usually larger. The vessels that carry lymph are much smaller. But these lie all under the surface of our skin. And what the lymphatic system does is it is a plumbing system. It collects lymph fluid throughout our body and it transports it to the center of the body where clean lymph fluid dumps into our blood vascular system. So basically what happens is that the little blood capillaries leak fluid all of the time, and a lot of that fluid that leaks out of the blood capillaries leaks back in, but what is left over, the lymphatic system picks up. And it's not a lot, but it's enough to also carry the proteins, fatty acid, waste materials from cells, bacteria, germs, all those things that have gotten into the body. So what lymph fluid is, it's basically what gets filtered out of the blood capillaries that doesn't go back in, plus all of the waste products and all the contents that are sort of in the tissue spaces that need to be picked up and cleaned out. So all of that fluid that gets picked up in the lymph vessels eventually makes its way to the lymph nodes. And so what do the lymph nodes do? Well, the lymph nodes are basically our recycling station, our cleaning station. And so the lymph fluid gets filtered in through the lymph node. The lymph node helps fight any infection, destroys anything that can harm you, and then it sends it back into the blood circulatory system closer to your heart. And the video we have is going to show that a little bit more. And I think one thing that I want to start out by saying is that we have many more lymph vessels than we actually need to keep up with the excess fluid in our body. The reason why I'm saying that is because a lot of people have lymph nodes that are removed, and it's kind of like, well, what's going to happen to all that fluid? Well, in a perfect world, we don't even use we use only part of the capacity of the lymphatic system. So when they do take out some parts of it, we usually can keep up. Sometimes we can't, and that's what we're going to talk about. So we're going to go ahead and watch about 6 minutes of a video that is going to go through and kind of explain how that lymphatic system works. So Tara, if you want to go ahead.
I woke up and I knew something was not right with my hand.
I had radiation, and it was a very difficult summer for me. And I remember in November, right before Thanksgiving, I noticed my leg enlarging. And I thought, oh, great, now what?
One morning, I'm sitting there doing my tie, and I can't do my tie. And I thought this was weird, and I look at my hand, and my knuckles are gone. That was the moment that I first noticed that I had lymphedema.
I just think it's good to know always that you're not alone, that there are lots of other people going through this. I didn't know anybody who had lymphedema when I was diagnosed, and I didn't know anything about it. And I think it's a process of just taking time to learn and seek out experts in the field and you use them to learn what you can learn from them and ask questions.
I was referred to a lymphatic specialist. And one of the things she did was actually give me the tools to be able to manage it myself and give me the confidence that I could control this.
When we think of fluid moving through the body, we usually think of blood circulating through the blood vessels. But there's another lesser-known network of vessels carrying fluid throughout your body. It's called the lymphatic system. The fluid it carries is called lymph. The lymphatic system has a number of important jobs. First, it acts as a drainage system. Excess fluid in your tissues moves into the vessels of the lymphatic system. The fluid is carried away and returned to your blood supply. This helps manage the fluid level in your tissues and avoid swelling. The lymphatic system also acts as one of the body's waste removal and recycling systems. It specializes in picking up large molecules in the tissue that can't be removed by the other systems. The lymph travels to many small capsules called lymph nodes, which filter out the waste. The lymph nodes also help defend you from germs. Lymph picks up potentially harmful materials, such as certain bacteria, and carries them to lymph nodes, where your immune system destroys them. Lymph follows pathways through your body. As it travels from one lymph node to another, the waste material and germs are gradually filtered out. At the end of the route, the clean fluid is returned to the bloodstream. Lymph only flows in one direction. If something interferes with the movement of lymph, it backs up in the tissue, causing swelling. This is called lymphedema. Edema means swelling. Lymphedema occurs at sites where some part of the lymphatic system is missing or not working, causing lymph to back up. The lymph system attempts to reroute the fluid, but some of it remains in the tissues, causing swelling.
The swelling, it can be pretty significant, and it also can be quite painful.
Swelling is not the only problem caused by lymphedema. Some of the material normally carried away by the lymph system also remains in the tissue. This buildup of debris may lead to discomfort, inflammation, and infections. Sometimes people are born without working lymphatic vessels or nodes in one or more parts of the body. More often, lymphedema occurs where lymph nodes or vessels have been surgically removed for the treatment of cancer. Lymphedema may also occur where lymph nodes or vessels are damaged, for example, by radiation treatment or a deep cut.
For me, what happened is because my cancer had spread to my lymph nodes, they were aware of that, so they removed several of them to to see how much cancer was in them. And then radiation treatment actually destroyed the rest of them. So I effectively have no underarm lymph nodes on the left side.
There are lymph nodes close to the skin, called superficial nodes. There are also deep nodes around large blood vessels. There are 3 major sets of superficial lymph nodes: in the base of the neck, the armpits, and the groins. Each set is responsible for draining lymph from a certain area of the body. When lymph nodes are missing or damaged, swelling only occurs in the parts of the body meant to be drained by those nodes. When lymph nodes in the neck are missing or damaged, you might have swelling in areas of the head or neck on that side. During treatment for breast cancer, lymph nodes are often removed from an armpit. In that case, swelling may occur in the arm, chest, breast, or back on that side of the body.
My lymphedema is in my left arm and hand and breast and my upper neck, shoulder area.
Missing or damaged lymph nodes in a groin may cause swelling in the leg or hip on that side, or the genitals. In most cases of lymphedema, only part of the section of the body drained by a group of lymph nodes becomes swollen. That's because usually not all of the lymph nodes serving an area have been removed or damaged. However, if the deep nodes are removed or damaged, swelling can occur in very large areas of the body. For example, deep nodes are sometimes removed in the treatment of uterine or ovarian cancer. This may lead to swelling in the lower half of the body. When lymph nodes have been removed or damaged, swelling may not occur for months or even years. This is called stage 0 lymphedema. You are at risk for the condition, but have no swelling. Not everyone who is at risk for lymphedema develops symptoms. Typically, when lymphedema occurs in part of the body, lymph continues to travel through that area, but at a reduced rate.
All right, so that gives a good overview, and I thought they had really clever animation to kind of help visualize how the lymphatic system works. So I want to talk about who is at risk for developing lymphedema. Those who have had a group of lymph nodes removed as part of cancer treatment are at risk. Now, what is a group? So if you have an axillary dissection, which is the lymph nodes that are underneath your armpit, there are sentinel node biopsies, which usually remove a sampling of lymph nodes in a group. So that is not a large risk factor for lymphedema. An axillary dissection involves removing a full group. So for example, if you heard something like they removed level 1 and level 2 axillary nodes, that would be indicating that you are at increased risk for lymphedema. If you had 3, 4, 5 nodes removed, your risk is not 0, but your risk is close to 0, so less than 5%. And so here we have a protocol and within the health system where if you have a level 1 and level 2 dissection or a large group of lymph nodes removed, you would, from axillary node surgery, you would have a referral to physical medicine so that you can talk about your personal risk factors and how to observe and survey for lymphedema. Most people, if you're going to get lymphedema, 80% of the time it occurs within the first 2 years of having those lymph nodes removed. That's not to say that you don't need to continue to be observant for changes, but if it's going to be swollen, it's most likely going to occur within that first couple of years. Radiation treatment on top of an axillary dissection can also increase the risk of lymphedema. And if a skin infection occurs, a skin infection is called cellulitis, and that is an infection of the tissue of the superficial layers of the skin. If that occurs in the part of the body where the lymph nodes were removed, that can also increase the risk of developing lymphedema. And that's the reason why we have a lot of our precautions, is to prevent our risk of developing an infection in that part of the body that's at risk for developing lymphedema. And so what is your risk? If, like I said, if a whole group of lymph nodes was removed, or an inguinal node dissection, and that's in the hip, an inguinal node dissection is one in which we don't have those same levels, but the risk for any node dissection is about 20%. Now, the next question that people usually have is, well, how bad is that swelling? And our aim as therapists and our aim as health professionals is to help you identify if you have swelling, so that if you notice the swelling, you know who to call, so you can get in sooner than later, because it can be easier to manage if we catch it sooner. The other question is, are you maintaining a healthy weight for your body? So in upper and lower extremity lymphedema, some studies show that having an increase in weight from the time when you had your original node dissection, so more than 10 or 20 pounds from the time of original surgery, can place you at greater risk for developing lymphedema. That is not to say that everybody who is worried about lymphedema should go on a diet, because if you are close to your ideal weight, stay there and just stay healthy. But if you are have rapidly gained weight over the course of cancer treatment, a lot of people do, because of changes to your life and to the way that food tastes and all of that. If you gain weight quickly, sometimes that can trigger maybe some swelling, and that's something to keep an eye on. Exercise is always important, and exercise is safe for individuals at risk for lymphedema. And I can talk a little bit about that later, but back in the mid-90s, we used to tell people, oh, be careful, you know, don't exert yourself too much or you'll cause swelling. But what we know now is that if we safely strengthen our bodies, we can avoid injury. And avoiding injury means you're avoiding inflammation, and avoiding inflammation can help you avoid developing swelling with lymphedema. And then I have to add this: should you quit smoking? Yes. If you are a smoker, you are depriving your body, your blood of oxygen. Oxygen is used to heal our tissues and reduce inflammation. So if you smoke, please stop. And hopefully people are telling people who smoke, you should stop smoking. But so how do you know what part of the body is at risk? And so this was covered a little bit in that video. But if you take a line and you draw it right down your nose, straight down your breastbone and down through your belly button, do the same line across your clavicle, your collarbone, and across where your belly button is, you divide your body into 6 zones. And so these 6 zones are the superficial drainage zones of each of these groups of lymph nodes. So we have lymph nodes, a large group in our neck, large group underneath our armpits, and a large group in our inguinal area or our groin. That area collects, those lymph nodes collect from the vessels that are all throughout the front and back side of your body in that zone. So if you've had your left inguinal nodes removed, so your left lower extremity, your risk would be in that leg, front and back, the lower part of the abdomen, and even in the buttock area. Likewise, if you've had your axillary nodes removed, you would also be at risk on your chest wall on the same side. In terms of an axillary dissection, so if they take out your lymph nodes in your armpit, it doesn't spread to the other side. However, if you look at the way the pelvic lymph nodes work, if the deep pelvic nodes are removed, there's a risk in swelling of all points below that. And the reason why is that the superficial nodes, and I'm going to go back to that picture so you can see, So the superficial nodes in the inguinal area dive then deep to these deep pelvic lymph nodes. And so if you've had deep pelvic lymph nodes removed, those are downstream from the right and the left side of the body. And so there is risk of developing swelling at all points below that. That would include the lower abdomen, the top part of the thighs, all the way down to the feet. And another thing that we notice is that rarely do legs swell equally in patients with lymphedema. So even if they remove pelvic lymph nodes, we rarely see swelling look exactly the same in both sides. And that's because of a lot of different factors that occur throughout our life, and even how the veins are working in our legs. And so when you have pelvic nodes removed, you do want to keep an eye out for swelling, and not just at your ankles, but also in your thighs and your lower body. Other factors can make swelling worse, like I said, such as poor venous flow in your legs or prior significant injury. Sometimes people will have a knee replacement after having a pelvic node resection, and then they'll start to notice that they have swelling. All of those things, the injuries such as the reduced knee motion, if you have weakness in your body part, anything that makes it harder for any of that blood or lymphatic fluid to move up and out of the lower part of the body can result in a little bit of backed up swelling in that part of the body. And so that is one of the reasons why, if you notice swelling and you are referred to a therapist like myself, where we're going to talk to you about swelling, we look at what else you can improve in your body that might help the circulation to return back to your heart, so that it's not hanging out in your legs and in your arm. And so this is a few pictures of how we would recommend a person watch for swelling. We don't have the same thing for the legs, but the reason why these pictures are helpful is that, first of all, if you look at the picture, the person's left arm is what is swollen. And it doesn't look like it's that swollen at all, but it is definitely swollen enough that we would want a person to give us a call. Come in if you notice some subtle changes like this. It doesn't have to be super swollen at all. So if you've had more than a sentinel node dissection, that means more than 5-6 nodes where they've taken out a full level 1 or level 2, or if they've done a full node dissection, you should check on the part of the body that is at risk for developing swelling a couple times a week or once a week, or if you feel a new sensation in that extremity. So besides looking for differences, so for example, looking at the difference in the vein patterns on the back of the hand, or the way the muscles are on the forearm, or the swelling on the inside aspect of the arm, what you really want to notice is, how does it feel? Check for the skin mobility by just taking your thumb and pressing it across your skin and trying to see, does it slide on the muscles that are underneath it? Because what will change before anything else is just that subtle mobility in that part in the arm or the leg or anywhere in the body. If it starts to feel like you can't feel all the muscles and tendons and bones underneath one side compared to the other side, then give us a call, let your provider know, because we would rather check it ourselves and help you if there is a little swelling, or look at maybe what else is going on. Sometimes people can hit with light pressure. What that means is that if you have some swelling that is maybe on the ankle and you put your thumb against your ankle bone, does it leave your thumbprint? That's called pitting. Certainly that's a sign that you have some swelling, and we would want to know if you have pitting edema. But if you notice any of those changes, contact your medical team or your therapist if you have a relationship with a therapist that's treating or helping you with your cancer rehabilitation or your lymphedema within a couple days. Swelling from lymphedema is generally a gradual, subtle change, and not maybe an emergency where you have to call that day. However, it's better earlier. If swelling occurs rapidly, which means you have a sudden change from one day to the next, it indicates that potentially something else is going on, like a blood clot or an infection. That needs to be checked that same day. So if you notice a subtle little change or you feel a sensation of fullness, then let us know within that next couple days. If you notice redness or a rapid increase in swelling, that means you'd be seen by a medical provider that day. Other warning signs. If the skin is red and hot, or if you have a new rash on the part of the body that's at risk for developing swelling, that indicates you could have an infection, a cellulitis. Cellulitis infection has to be addressed within less than a day, and so that you don't have more damage occurring to the lymph node vessels that are involved in that infection, and so that that infection doesn't continue to spread or get into your bloodstream where you get really sick. And so a lot of the education we do is saying, hey, if you notice a real change in color, if you have a headache and you don't feel right, and you see something also on that part of your body, that's like an urgent care, like you got to get in to get that checked kind of thing. If you have pain with your swelling, lymphedema typically doesn't cause pain. And so if you have pain, you need to have that assessed as well. Lymphedema can cause tightness and limb restrictions and heaviness, but pain is different. And then finally, if you have weakness in the body part affected, lymphedema should not cause weakness. So weakness would be something else. You would want to have that checked out as well. So I consider those warning signs actually for things other than lymphedema, and I just need to make sure everybody understands that too. So can lymphedema be prevented? That is the million-dollar question. So there are two main categories for preventing lymphedema. When I say preventing, sometimes lymphedema happens despite our best efforts. And then our job as therapists is to manage it early and as completely as possible. But what you can do to minimize your risk of developing progressive swelling in that body part at risk is these two major categories. Number one is to protect against infection. And what we do to protect against infection is that if you are at risk for lymphedema from having those groups of lymph nodes removed, try to keep your skin intact as possible. And of course, when I say that, there are some skin being intact that's different than others. So for example, the risk of getting a shot from an injection is a much cleaner thing than falling off your bike or tripping over your lab on the cement and scraping off skin on your arm or scraping off skin on your knee. And so when I say keep your skin healthy and intact, of course, reduce as much of the risk of opening up your skin as possible. And some of those restrictions that you hear about, so avoid injections and IV lines, those are designed, those restrictions are really specific to keeping your skin as intact as possible. I do feel stupid saying, please don't trip over your dog, because nobody goes out trying to trip over your dog. But if you do get a cut or a scrape, or you get that oven rack burn that everybody gets when they're trying to pull a pizza out when they're super hungry, if you do get something that's an open area of your skin, and it's in the region of your body that's at risk for developing lymphedema, then what you do is you just baby it a little bit more. You don't ignore it. So if you have a burn, treat it with a little bit of that antibacterial ointment, cover it with a Band-Aid, even if it's something that normally you would just forget about. So for example, if you are doing lawn work and you get a blister on your hand and you're at risk for developing lymphedema in your hand, then by all means, try to keep that skin intact. If the blister opens up, don't go digging in the dirt with a hand without a protected glove. Keep your skin clean and intact as possible. When people do get infections, they usually can think back to what did it. We do have patients who get recurrent cellulitis with no apparent trigger for those infections, but those are also typically people who already have lymphedema. People who don't have swelling typically don't spontaneously get infections, but we do try to be careful to keep your skin intact, and it's only a precaution that needs to be taken in that quadrant of your body that is at risk. So the other one is stay fit, stay strong. So avoid that rapid 10 to 20 pound weight gain in a year. That weight gain puts a lot of extra work on the body, especially if it occurs in a person who's at risk for lower body swelling, because gravity's not our friend in this case. And it's harder for your veins and your lymphatic vessels to move up and beyond your abdomen with excess weight. So avoid weight gain if you can. Strengthen your muscle pump. What does that mean? It means keep your muscle mass great, keep it big, because our muscles and our joint motion help return venous fluid to our heart. It helps return lymphatic fluid to our heart, and keep your body moving. When we move our bodies, we also increase our respiratory rate. All of that respiration, body movement, all increases circulation. Our bodies are made to move. Moving our bodies help them function better. Of course, said like a physical therapist, but we treat everything with movement, and this is no different. So what about all those restrictions? This gets really confusing for people because there's all these do's and don'ts, and we don't like to speak in do's and don'ts. So needle sticks, IVs, blood draws should not occur on the limb at risk if possible. Research has shown that these things do not cause lymphedema, but since they are procedures where there's a break in the skin, it's advisable to just avoid those occurrences. So for example, if you had your lymph nodes removed, let's say you had your lymph nodes removed for breast cancer when you're 65. And when you're 80, you have to have your knee replaced and you go into the hospital and they'll put a yellow bracelet on your wrist that says not this arm. The reason why they're doing that is, even though we're saying, well, an IV stick doesn't cause lymphedema, the reason is we just try to reduce your risk of any negative occurrence. So for example, if you had an IV in an arm that was at risk for lymphedema and that IV got out of place and pulled and infiltrated the tissue in the area, it would be your lymphatic system that would have to help drain that tissue. And it's just not worth the risk. So just choose the other arm. Likewise, those automated blood pressure cuffs can be really tight, and sometimes they just go and they can keep going up and up and up, and then they go down and then they go up again. And I've seen patients who get bruised from those automated blood pressure cuffs. If you get a blood pressure taken and you get a bruise and you break some blood vessels and then you have dead blood cells in that arm, that is what the lymphatic system would have to actually carry. And our whole goal here is to not put too much excess lymph fluid on a lymphatic system that's been interrupted with surgery. I always think of it as putting too many cars on a road where there's a lane closed. Just try to avoid putting too many cars on the same road. And that's the reason why we just avoid getting a blood pressure done on that side. Now, there might be some of you out there that's like, well, I had an axillary dissection on one side, and on the other side, they took 5 lymph nodes. What am I supposed to do? And what we would say is use the arm that's less at risk for developing swelling, because we know that there seems to be no direct link between a blood pressure taken and the occurrence of lymphedema. But once again, still trying to avoid risk. And then finally, air flight. This is something that has been studied in larger populations. So initially there was anecdotal reports of people developing swelling when they were flying. When they took larger groups of patients and they had them fly internationally, what they found is that those groups were not any more likely to develop lymphedema. The concern was, does the reduced cabin pressure in an airplane cause swelling? Which, when you really think about it, doesn't make much sense, because lymphedema does not occur more frequently in places where there's higher elevation. And so we no longer say if you're going to fly internationally, you should get a compression garment. But what we do believe is that it's all the activities around an air flight and travel which can predispose some people for more swelling. And so, once again, it's kind of one of those things that if you are at risk for developing leg swelling, and you know that when you fly, your shoes get tight, your ankles get a little swollen, wear a compression garment, because that's when your body just will swell. Maybe it's from sitting with your legs down, eating salty food, standing still in lines, not being able to do your exercise that day. all of those things that are not part of your usual routine that your body needs to have its normal function are disrupted with travel. And so that's the reason why if I have a patient who's like, I'm kind of worried about flying, can we talk to my doctor about getting a prescription for a compression garment? I'm usually like, yeah, sure, that's fine. One thing is, don't let the first time you wear that compression garment be the day you travel. So if you are concerned about swelling during air flight, try out your garment for the amount of time that you would have your traveling episode. Meaning if you know you're going to be up at 6 and you're going to get to your destination by 8 p.m. and that compression sock's going to need to be on the whole time, try it before you do it. And the reason why is because sometimes they roll, wrinkle, cut, and we certainly don't want that to happen. Now, what about heat? What about overuse? And so this comes down to that whole avoid saunas, avoid hot tubs. So heat is what I'm talking about in terms of use of a sauna or a hot tub. It has been associated with increased swelling in studies. And it makes sense physiologically, because what happens when you get hot is that you have increased blood flow from capillaries towards the surface of your skin to cool your skin surface. When you have the increased blood flow going to the surface of your skin, you have increased pressure in those capillaries, and that increased pressure causes capillaries to leak more fluid into the tissue space. The tissue space that is around the blood capillaries, if you can't get that back in the blood capillaries, the lymphatic system takes back that fluid. And so heat can increase swelling. And so if some of you are thinking, yeah, it's summertime, my arm, my leg, they have been more swollen. Yeah, that's probably actually what's happened. So how do we respond to heat? Do we all move to Canada? No. But what you might want to realize is that if you are exposing yourself to heat, maybe you do need to wear your compression. If you like to exercise outside, maybe you need to get up a couple hours earlier to exercise when it's cooler out, because some people are more prone to trouble with heat than others. I have patients who don't have any trouble with heat at all. They don't notice any increased swelling, and that's great. If you don't notice any problems with heat, you probably are fine. It's just something that some people have more than others. And so that's why, once again, always use surveillance. And then the final thing here on this slide is the overuse. So overuse means using a limb above and beyond what it's used to for that limb. And so everybody's overuse is different, and it's based on what your typical level of activity is. Overuse injuries that cause pain cause inflammation, and sometimes that can cause more swelling. And if that happens to you, the first thing we do is, if you notice a period of episodic swelling in response to an activity, we apply compression to that, probably a compression garment. But in the long term, the best way to avoid this is to strengthen yourself and to prepare yourself for the activities you want to do. So I have had patients who are at risk for lymphedema train for a marathon. Those overuse is part of endurance training. And so they might have to do a long run 1 day a week. We talk about that. We talk about using more compression on those days, even after that run, if that's needed. But for the people who aren't training for marathons, train for your life. If you have had a long period of inactivity due to your cancer treatment, and you're like, I was in the gym 2 years ago, I'd love to get back into the gym, there's a way to do that. You just need to do it gradually. You just need to slow down, start low, go slow, adapt your body to that physical change, ultimately making yourself stronger, which is ultimately going to help avoid future injury. And that's why we like to help people kind of get back to their fitness program. That's actually one of my favorite things to do. So what to do if you think you have lymphedema? If you think you have lymphedema, talk to your care team, talk to your cancer team or your primary care physician. Refer to a lymphedema therapist. If you're watching this and you're not within the Mayo Health System, most cancer centers have a group of therapists who have been specifically trained to treat lymphedema. One thing you can do if you're curious, like if you're living somewhere out like Bismarck, North Dakota, and you just Google search lymphedema therapist, Bismarck, North Dakota, it will come up. You might see CLT, and CLT means they are a certified lymphatic therapist or lymphedema therapist, which means a CLT therapist has had over 120 hours of being trained for treating lymphedema beyond their usual school. So a lymphedema therapist can be a physical therapist or an occupational therapist. When in our clinic here, we do the same thing. We both treat lymphedema the same way. A CLT-LANA, so CLT-LANA, which is, which is that many letters after a name, means that the CLT therapist has also passed an exam and paid money to do so. So it generally implies that somebody's been doing it for a little bit longer, which can kind of help. And if you're looking for a lymphedema clinic, and you have a couple options, I recommend always choosing the one that has more than one lymphedema therapist, because it means they've probably been doing it longer, and that's always helpful too. And so what is lymphedema treatment? Well, we prefer to do early management. And what I mean by early management is that if you notice swelling that just kind of occurs maybe once or twice, goes back down again, we want to see you, because we would want to prepare you for a contingency plan if that happens again. And that's probably going to be applying a compression garment, a compression sock, or a compression sleeve, compression bra, compression body part, anything like that. Early management helps, because if we can help you identify it, what to watch for, and give you a tool to use if you are putting yourself into a situation where you're concerned about that occurrence of swelling occurring again, we can prevent that, and then we can have better long-term management, which means not having those episodic incidences of swelling. Compression garments, sleeves or socks, are used to keep the limb the same size. And the reason why I mention that is that if you have hitting swelling, if you cannot feel the muscles in your arms or your legs because of the amount of swelling, or your skin feels hard and it doesn't stretch, putting on a compression garment is not the where you want to start. It has to be reduced first. And we reduce arm or leg swelling by compression wrapping. And the reason why is that wrapping is offense, meaning it will get you to where you want to be. It will make a limb smaller, where a sock or sleeve stays the same size. It doesn't really shrink with the size of your limb. So if you do have actual swelling, we are going to try to wrap that, get it smaller, and make sure that once you're at your baseline small size, you have a compression sock or sleeve that you can put on and be much more mobile and more active than you would be in all those compression wraps. Compression wraps don't really work well with putting on your normal work clothes and getting through your workouts and all that. And so as time goes on, if you're working with a lymphedema therapist, our goal is to always have a management program that is the most effective and the least burdensome to keep the limb at the same size. And that's going to be different for everybody. Some people just need a sleeve when their arm swells occasionally, when they play that first 18 holes of golf in the springtime, or when they are traveling 8 hours by car to go visit somebody. Other people have to wear a garment or a sleeve or a sock every single day and wrap their limb at night just to keep up with it. And those are the things where having a specialist who knows what products are available, what combination of things might be most successful for you as an individual, it takes that approach. Everybody's going to be different. And so I have to emphasize that compression is always the most effective way to reduce limb size. That initiating compression at the first signs of swelling is the most effective way to control lymphedema. And question that I answer a lot is, well, if I wear a sleeve or if I wear a sock, will it prevent lymphedema? We don't have any studies that show putting sleeves or socks on a large group of people reduces the risk. And mostly it's because people would prefer to help as soon as they notice a change versus having to wear a sleeve or a sock unnecessarily. We have other techniques that we use to reduce the limb besides compression, that are things like massage called manual lymphatic drainage, or we have pumps that pump air and around a sleeve that's put on the limb that helps reduce the swelling. But neither of those things replace compression. They can be done, they can feel good, but if you want long-term day-to-day management, you have to have compression on. And the goal of managing swelling is really to prevent that risk of infection and progressive skin changes that occur with lymphedema. And so when we are going about our management program, once again, finding that most effective, least burdensome combination, we are always thinking, how do we prevent this from progressively getting worse? How do we prevent this person from being at risk of swelling? And so to keep in mind, once again, I think I'm going to stop my share so you can see me. So I'm going to go back to that risk factor of that 17 to 21% of people being at risk for developing lymphedema. That does not indicate a severity of swelling. And I think where I feel badly is if people look online and they go lymphedema and then they have pictures and they see these really large limbs. You don't go from no swelling to a really large limb in less than a week. It does not happen. And there are people out there who can help you manage the swelling or even help you answer questions related to your risk for lymphedema. And so if you do have any of those concerns, I really encourage you to talk to your medical team, your oncology team, or your primary care physician, because I never feel like I have an unnecessary visit here in therapy. I think that worst case scenario, you come in and we're like, I don't know if that's swelling. I think you're probably sore from radiation. Have you been exercising? And then we'll show you or remind you about your exercise program. And so I'm going to open up for questions. I think we have some time for that. Does anybody have any questions?
All right. From what I can see at this point, I don't see any questions yet, but I just want to emphasize that it was such a wonderful presentation. I think this was so much great information for a lot of patients that maybe aren't quite aware of, what lymphedema is and, just the possible risk factors when, you're going for treatment, especially when it involves in, having the surgery in those areas that, there is that potential. So let's see.
And then maybe I also want to mention, when they're planning cancer treatment, the oncologists and the surgeons are planning it for the best chance of your outcome, your survival. And so I really do encourage people to base your choices about your treatment based on your best chance with what your doctors are recommending. As a rehab person, we'll deal with the rest. We can help with whatever it takes to help you treat your cancer effectively. So.
All right, I do have some questions coming in actually, so great. First one is, what do you do if it is in your neck after dissection?
That's a great question. And we do see a lot of head and neck lymphedema and head and neck things related to that. One thing that's different about head and neck lymphedema is that it rarely is progressive because gravity's on your side because you drain this way. And so ongoing 23-hour-a-day compression is not practical or necessary. And so we treat it a little bit differently just because it's on the top versus below. So we manage with a lot of active exercise to help reduce the effects of the neck dissection and the radiation treatment. We look at other things related to head and neck cancer treatment, which can be really tough on jaw motion, on fatigue, on shoulder pain and weakness, on neck mobility, and also generally just on the way that you get scarred. And so lymphedema treatment is one part of head and neck rehabilitation following that cancer treatment. And so short answer is we use compression, we use massage, we use stretching, but boy, if you have that as a concern and you're within the first year after your radiation treatment, I strongly recommend you get into therapy sooner than later. It's much easier for us to treat something within less than a year out from radiation treatment with head and neck cancer.
Great. Thank you. Next question. Once you have lymphedema, do you ever get rid of it?
Sometimes yes, sometimes no. What we know is that if you can get the lymphedema under control when it's still reducible, when it still can reduce to the point where the two limbs are eventually, kind of the same size, we can keep it there. How much we need to do every day to keep it there is a very individual thing, and it has to do with a lot of other factors. We know that this is different than what it was 20 years ago. We used to think you'd get lymphedema and then it was just the steady curve forever. And what we know now, looking back at people who have these blips of lymphedema, is that there is no set standard way progression is going to look. Some people have these blips, and some people have progression, and some people have one blip and then it stays low. And that's the reason why we like to be involved really early, because if we can see you early and do regular surveillance to make sure you're doing exactly enough to keep it down, but not so much that it's driving you up the wall, we can keep it down. In some cases, it's a bad situation and lymphedema is really bad, and then we continue to assist. But that's a really good question.
Perfect. I do have another question here. I have lymphedema. What are safe arm exercises with light weights I can do to strengthen my muscles but do not harm?
Okay, the safest exercise you can do is one that you can start at a very low level. So there's no one exercise that's harmful. In general, I would always say it's more important to strengthen your upper back and your core than doing bench press. So bench press isn't going to hurt you, but it's kind of silly. Bench press isn't functional unless you're pushing open lots of doors. But I would say that if you're going to start doing any exercise, my recommendation is to start with 1 pound weight, the lightest weight possible. And if you typically are used to increasing by the smallest increment every week, extend it to every 2 weeks. So for example, let's say you have some 2 pound weights at home and you're doing biceps, you're doing some triceps or tricep kickbacks, or you're doing some rows, you're doing some shoulder press. Just start by the lowest level. If you can do 10 to 15 reps, keeping good form, knowing that you can do more, then after a couple weeks, go to that next weight up and just increase really slowly. Every time you increase, make sure, survey your swelling, make sure you don't have any swelling. And so there was a very large study that was done on the East Coast, and they had patients do all kinds of exercising every major muscle group, and they found that that group did well as long as they progressed really gradually and then backed off if they noticed any problems. Exercise is good. It's going to always help.
Perfect. Such a great answer. I love how you stood up and gave a little bit of the demonstration. It's great because not a lot of patients know what the exercises are named, what the names are associated with that. So it's great. There is another comment question here. Is the 17 to 21% risk vary according to how many lymph nodes removed? How about for an axillary dissection? Does that risk percentage remain the same?
Yes. That's the thing, is that everybody's given a different number of lymph nodes. And so, when they say, oh, I had 32 nodes removed versus 20 nodes, well, if you only started out with 20 and the person with 32 started out with 50. So when they do these studies, they basically say, were there more than 10 nodes removed? Yes or no, did they get lymphedema? So these are not done as a sliding scale, and there is no information on a sliding scale. And I don't know if we have any more insight if we did. We do know that everybody is built with a different amount of lymph nodes when you are born. There's some indication that some people have more sluggish lymph vessels than others. There's some evidence to show that those people will be more likely to get lymphedema. We have no idea who those people are. That's the reason why if you have a group of lymph nodes removed, you should be seeing somebody in that first year every 3 months for surveillance and every 6 months in that second year, so that we can really show you how to watch for it.
Oh, fantastic. All right. We can always give it just another moment. That's all the questions there are right now. But again, thank you so much. This is wonderful information, like I said already. So seems like we have some good questions that were coming through. So If we don't have any more questions, then we can probably go ahead and conclude for today. And certainly, like I said, we did record this session, give it 3 to 4 days, and we will have this posted on the Connect site along with some of the resources as well. There is a functionality with that too, that if you wanted to connect with someone, that you're able to ask questions there and we can connect you with the right resources. So. All right. Well, thank you so much.
Thank you for the
And
opportunity.
yes, thank you. All right. Bye now.